So, all through the semester, we've been gathering data, if you will, to understand more about the client. And in gathering data, as you know, we have been in the process of doing an assessment. For some situations, you only get one session to put a treatment plan together. So you have to do your assessment of the client and then also go into treatment plan gear at the same time. So in this situation, you've had the opportunity to not just get to know one client, but many different clients in different circumstances. But that essential understanding of the assessment process is what you've been able to get. So now you've arrived at a point where you're ready to put a treatment plan together. And again, with treatment plans, they're sometimes very much agency dependent. You're given a template of what needs to go into it, how it needs to be presented, et cetera, et cetera. But in other times, you have an opportunity, and as you develop and evolve in the social work profession, you might be able to get more control over this. You're able to help to guide and shape the treatment plan according to the way it fits for your specific client. So we have the SMART goals. So this is a way of, instead of just saying, come up with a treatment plan, a lot of different people will come up with a lot of different things. Here I'm proposing one particular way to approach the treatment plan and the content of the treatment plan and why the content is so important to present. So we're going to talk about what is the treatment plan and how do the SMART goals fit into it? What exactly are the SMART goals? And then where do they fit into the process of treatment planning? And then what's the outcome in terms of looking at these SMART goals? And in what situations are they important and appropriate? So, first of all, why is it important to do treatment planning? Sometimes we're just told, do a treatment plan because that's just protocol, it's just part of what you do. And other times we get more structured information about what is the treatment plan. The treatment plan, if you will, is that car that we use along with our client to drive the direction of the work that we do. Before I say anything else, I want to make it clear, just as I did in Blackboard for this module, I think we're module 12, um, this is at every step of the way a collaborative process. You do not dictate to the client what they're going to do or what the treatment plan is going to look like. You work with the client. The reason why collaboration is so important is if you go ahead and set up the goals, or you set up the goals that you think the client might want, and they don't reach them, they have that experience of failure and also the experience of failure in something they weren't invested in the first place. So, once again, we're talking about a collaborative process. We're talking about a roadmap that's specialized just for this individual. So once again, you can help the person track their progress. You can look along with the client and say, it looks like we need to provide you with more resources in order to help you along the way with your goals. And again, that personalization, that individualization that can be a challenge to offer when you have to do that template or kind of systemic um, treatment plan. When you have that treatment plan in place that has that structure, There's evidence that your client are more likely to adhere to the treatment plan. There's more satisfaction because they feel a part of it. Again, treatment plans should help the client feel empowered. So what do we mean by SMART goals? SMART stands for specific. It's got to be specific, measurable, achievable, relevant, and time-bound. And in doing that, you're able to help the client in terms of establishing very clear understandings of what's going on and a clear understanding of what they need to do in order to get to those goals. And also in setting up a SMART framework, you often find that clients are more motivated to be a part of the process. So in terms of objectives, you're looking at things that can be tracked. You're not just going to say, the goal is that the client is going to feel better about themselves at the end of our time. That doesn't work. To be able to say the client will have achieved 5 different ways in which they have felt good about themselves and haven't in the past is more measurable. It's more, they're able to wrap their hands around that. They have to be realistic and attainable. It's not just, once again, the client's going to feel better about themselves or the client's not going to be depressed anymore. No, it has to be something that's consistent, that is realistic in terms of the resources that the client brings to the relationship, as well as the resources that you can bring to the relationship and the client's journey. They have to be contextual, right? In terms of looking at the objectives, contextual. Do they make sense in relation to what the client is trying to address? And then clear in terms of a timeline, right? So it's not just a matter of going back to that client's going to feel better, client's not going to be depressed. At the end of 12 weeks, client will feel better by having achieved these 5 things. Again, keeping it concrete is so important. We see that with the SMART goal perspective in terms of looking at treatment plans, folk have more adherence. Clients are more likely to adhere to the treatment plan because they have a clear focus, a clear understanding of what's expected of them. So let's look at the framework for SMART goals. Once again, clear objectives. They know exactly what needs to happen. The clinician knows how to work with the client in terms of providing the interventions that they need. And with this clarity comes a reflection of the client's expectations, right? What is it that they want to do? And how are they being supported more consistently in terms of working with the clinician on the treatment plan? So what do we mean by measurable? Set quantifiable criteria so progress can be tracked. It could be specific behaviors that you're tracking. The client will, they might have a fear of going outside. So the client will start by going to the front door and you'll take it from there. Consistency, right? In terms of using a scale. If you go back to the example where the client will no longer feel depression, something like that, that's great. Now we can go back and look at a scale. It could be Beck's depression. That might not be appropriate. You might need to find another scale, depression scale, that works better. It doesn't have to be a scale. It could be client shows up 4 sessions. It could be, once again, behaviors that you want to look at. How do you evaluate effectiveness? What are you seeing in the client? What does the client see that's working? And what needs to be tweaked? What is the client saying is not working? Or what is the client demonstrating is not working? So you need to change gears. And then show those gains, show what's going right. So it's not just a matter of you start with the goal and then you end by measuring or assessing the client's achievement of the goal, but along the way, step by step, you and the client are able to show the gains that the client is making. Once again, the goals are realistic, but they're ones that are also motivating, that the client will want to do. You know, if you're working with a child or you're working with an adult even that's gone through trauma and you want them to do belly button breathing 3 times a day, I mean, you could, but are they actually going to stick with it? Is that something that they enjoy doing or they don't enjoy doing? Um, and is it something where the effort to take the time out to do it is more stressful than actually doing it? Um, Clear deadlines. Once again, folk have busy schedule. Whether you're working with kiddos or adults, folk have busy schedules. So put a time frame around the goals. And it also helps in terms of when you put that time frame or deadline in terms of goals, that's also something that's impacting termination. So clients aren't caught at the end of their time with you thinking, why is she now telling me that, this is the end? That's part of what they're tracking too. So now we have the goals laid out. We see how they're defined. What does it look in terms of the treatment plan? What we've been doing all along is assessing. And in terms of assessing the client's needs, remember we've gone through the biopsychosocial, and we'll talk more about the spiritual aspects of it. So looking at what does the client's environment look like and what needs to be addressed? What does the client feel needs to be addressed? Wherever appropriate, use standardized measures. There's some standardized measures that you have to be trained to use. There are other standardized measures where you have to pay to use them. There are others where you need a psychometrist or a psychologist trained in using measurements. So you don't need to use measurements though. You can use a chart, you can use different types of things. When you have an accurate assessment, so you've gone through the biopsychosocial, then there is a better chance that when you're putting the treatment plan together with your client, they're going to reach their treatment outcomes. So once again, it's specific. What is a clear outcome that's consistent with the client's needs? What is a criteria you can use to track individual progress? And again, this could be it could be a structured measurement, could be a calendar, could be a journal that tracks behavior, it could be a lot of different things. Are the goals realistic? Making sure that the client has a say in setting the goals so they feel a sense of accountability for them. And then how the goals link directly to what the client wants. Documenting and communicating treatment plans is important. Clear documentation is important because it establishes how the care is going to happen, how the client care is going to happen. And this is something that if for some reason you can no longer work with the client, the next provider will be able to have a clear understanding and roadmap about how to proceed. And once again, it provides transparency for the client who's able to experience a sense of empowerment. Using client-friendly language is very important. Also, using visual aids can become very important. In doing these things, there can be more of a sense of understanding of what's going on and also a sense of engagement. How do you know what's working is working? How do you know it's working? Tracking those outcomes are so important. When you're tracking or monitoring how the person's doing, there's more of an opportunity for improvement because you're tracking it. They're not kind of wallowing in, this is where I was and this is where I want to be and how do I get there, right? You're helping them to look at the step-by-step improvements that they're making. So in terms of adjusting goals and interventions, you can be looking at, and you might not have the luxury of this type of a time, but you adjust these goals at these particular intervals, or you revisit the goals at these particular intervals to determine whether or not they're working. Once again, you're looking for motivation. You're looking for also, you have to support the client. You are providing the insight and the motivation for the client to keep going. And what we know is what's been evidenced is that when clients feel motivated, then there is a higher chance that they will achieve their goals. There's also sometimes you can do tracking and rewards in terms of providing AI assistance, and I won't go into that too much here. So one obstacle is it's just not realistic what you're trying to do. Another obstacle is the client from the get-go just kind of drops off. They're not interested, they're not engaged in the goal setting process. It's just no. So you have to stop right there and find out what's going on with the client. Misunderstandings or unclear communication. So the client doesn't really understand what you're saying. The challenge is sometimes a client doesn't understand you're setting a goal or you're talking about a goal. They don't understand, but there's that power dynamic. So they don't feel safe enough or comfortable enough, or they don't know you enough to say, I don't understand. They simply let you take the lead. So you have to watch for verbal and nonverbal cues that things are kind of going off the rail. Once again, if your objectives aren't clear and if they're not clearly measurable, if there's no clear way to track the person's progress towards those goals, then it's not going to work. How do you overcome it? Teach the smart way. Teach and provide clear examples of ways in which to reduce that sense of vagueness or not really clear. Collaborative goal setting. We work from an empowerment collaborative framework, so we know how to do that. We constantly refresh our skills. Once you become licensed, you have to take continuing education units in order to keep your license. And those are great opportunities to take trainings or workshops on treatment planning, that type of thing. Motivational interviewing. So, reflective questions that maybe if you have a disengaged client, helps them to reconnect with you. instead of culturally sensitive approaches, I would say provide or practice cultural humility. And we've already talked about that, so you know what I mean. And then you can have uh, structured protocols or standardized processes in place to work towards getting to the goals. So, clear objectives. Um, there is the shared goals, there's the collaboration, and that helps with getting the client engaged. There are clear, measurable ways in which progress is tracked, and then adapt with confidence so that the goals that are established are ones that are clear to the client, that they're reachable, that they're attainable, and that in setting the goals, you also work with the client on anticipating any barriers or points along the way when you might need to adjust the plan.